My name is Adebayo Alonge. I'm the co-founder and CEO of RxAll. RxAll is an AI platform for real-time drug quality checking and surveillance. I trained as a pharmacist at the University of Ibadan, and so that helped prepare me to understand the whole pharmaceutical industry. Secondly, I also got my management training at the Lagos Business School, and that helped me infuse elements of human-centered design, problem solving, and essentially overall the build-out of a management system that enables scale. Lagos Business School was very essential for me to think about ways in which I could create a business for sustainable social impact. I'll say this was the core of it. I went into the Lagos Business School thinking that I wanted to become a manager, a middle-level manager in a pharmaceutical company afterwards. But while I was at the program, the school's focus on social impact, on changing the society for the better as we build up our companies, helped me understand that I could actually create a company that would actually make a big difference across the world. And so one of the key classes I took with Professor Henrietta Onwuegbezie also spelled out that maybe the path that I should pursue should be entrepreneurship, and doing entrepreneurship in a very different way, in a way that's focused on social impact. Yeah, so under 5 mortality is a big issue, especially in developing countries, particularly so in sub-Saharan Africa. And the reason why this problem happens is firstly because many of the women who give birth to the kids are not educated, right? They don't have the type of formal education that is necessary to be able to take care of a child. We also have, in some countries like Nigeria, a lot of young women giving birth, women who are under 18 years old who are giving birth. And so many of these kids actually are born underweight, born into poverty. They don't have the kind of resources to help them go through the early stages of life. And then a third reason is also in terms of the distribution of healthcare services and access. So hospitals, still too few hospitals, still too few health professionals. So a child that is born in a developing country like Nigeria is at a far higher risk of dying before he's 5 years old compared to a child born in the US or Canada. Now, there are number of ways this problem can be solved, right? One is policy. Right, so really the governments in these regions really prioritizing healthcare, prioritizing children's access to healthcare services, prioritizing also the training of healthcare professionals like midwives, pediatricians, gynecologists. On the non-policy end, now where technology serves as an enabler, so like with us at RxAll, one of the solutions that we actually provide is a means for healthcare centers to make sure that the medications that children are receiving are of the highest quality possible. There's also the possibility of building a platform where a mother can actually ask a doctor using a phone without needing to leave the home if she's noticing that child is sick or needing some kind of advice to help her take care of a child. Right? This is where technology can come in, but technology cannot stand in isolation to policy. Right? Policy needs to enable the impact of technology to be able to reduce the unfortunate number of young people who die before their time. At the moment, our machine learning platform enables regulators, drug regulators like NAFDAC, for example, to carry out real-time drug quality checking using a mobile phone. But on top of that, right, what is really very valuable with our platform is that it provides a real-time surveillance map. So for example, an agency like NAFDAC can see in real time across Nigeria where bad drugs are showing up. They can filter that information by location, by GPS location. They can filter that information by batch numbers. They can filter that information by brands. They can filter that information by expiry dates. And so they can also feed in that information into the WHO's GSMS system to prioritize medicines that have also shown up in other parts of Africa for being low quality. So that way they can then take immediate action to pull out the bad drugs from the medicine supply chain. At the heart of it is our focus on the human problem. We notice that a lot of startups are either thinking about how much money they can make at the end, or thinking about fundraising as the end goal. For us, we have always focused on the human problem, right? Even though we've had opportunities to move the solution into cosmetics or move the solution into narcotics, for us, it's always been about how can 1 million people across the world die every year because of falsifier and substandard drugs, and nobody's doing anything about this, And so I think this is where young African entrepreneurs really need to focus and differentiate. Think about ways in which I can use technology to make a difference in my community. How can I use technology to reduce poverty? How can I use technology to make a change in the lives of young people, the poor, the homeless around me, And I think as more Africans think about it this way, rather than just wealth accumulation, and rather thinking about using technology for social good, then they would then stand out more. Then they would then rewrite the whole African narrative and improve the living conditions for the vast majority of people. This would be my recommendation.